Thank you very much. Thanks for coming today, early in the morning. And this is really small gathering, and we can talk very intimately, and we can get a lot of collaboration after this, meetings. And I have been working for PHI more than 15 years, and before that UCSF, and I met Dawn and Emiko, and yeah, this project funded by SAMHSA, Substance Abuse Mental Health Service Administration, for 5 years, and it's a Category 2 center grant, and we have been addressing mental health issues or trauma-informed care and prevention for particularly Asian American and Asian immigrant. And we have done two workshops. This is the third workshop, and one workshop we're focusing on trauma-informed care and mental health issues among Afghan refugees, particularly in Sacramento area. And it was really good gathering, and we worked with local service providers, and we have at that time Afghan background staff. He organized very well and worked with professors in UC Davis. And second workshop, we addressed mental health issues, particularly for Asian immigrant and Asian American in San Francisco. And we have been working with RAMS, Richmond area multi-service agencies, and Angela and Cruz here. And we have done quite good workshop, and also after that we plan to further strengthen mental health services, particularly for Asian populations in the Bay Area. And today is a third one, and it's a new area. We have never been here in Atlanta areas, and so we really need a local collaboration. And Jean here, and we really appreciate Jean's help for this gathering, and also Dr. Dawn Operario, Emory University, and those local collaborators really we need it. And not only we gather here and talk about mental health issues for Asian immigrant or Asian Americans, but certainly after this gathering, we try to get some connections and networking, and try to find it out future programs or collaborations to address particularly mental health issues for Asian and Asian immigrant. That's our main purpose. Yeah. And we keep doing, and next one, we are planning to work with professors in the University of Hawaii, and we try to address mental health issues, particularly Native Hawaiians in Hawaii. And that's what we're planning to this year. And hopefully you enjoy this gathering, and we can have good food, right? So please stay as long as you can. All right. Thank you.
Thank you, Dr. Tooru. Next, please join me to welcome the mayor of Brookhaven, Georgia, Mayor John Park.
Hi, thank you for having me here. A little bit about myself. Being mayor is actually my side gig. A lot of elected officials in the state of Georgia are part-time, and so, which leads me to my full-time job. I actually work in public health informatics. So PHI and the Emory School of Public Health, Rollins School of Public Health, the various organizations, you're no strangers to me. I do contract work in nationally notifiable diseases for the CDC and public health agencies and public health laboratories. And so, in fact, last year I was at Rollins recruiting public health clinicians, public health students to our company, J. Michael Consulting. And so I really have an appreciation for the work that you do. And as mayor of Brookhaven, recently being elected mayor, we use a lot of my experiences, whether it's in my personal background or my professional background in the work that we do. And and I just go back and think about when my family first immigrated to the United States in the early 80s. We lived in parts of Alabama that were very welcoming, and we also lived in parts of Alabama that were not as welcoming. And that was an interesting experience, to say the least. Some of us kind of weathered it. Little things like, when my brother got hurt pretty bad, and we were wondering, can we even take him to the hospital? Are they going to welcome us, or are they just going to kick us out because we're foreigners? Little things like the constant bullying that some of my younger colleagues, friends, were subjected to. And his response was, before he moved away from that city, to take a baseball bat and respond in a very unproductive way. So those are some of the experiences that come to mind, and in my heart, I see why it's important to do the kind of work that you do. Because as I've progressed in my life and in my career, and done various things like work in public health and work in informatics, and now work in public service and government, I'm seeing that even though government should be equal and provide services to all, we don't provide services and do things the same way for everyone, right? We have to tailor things for certain communities, and if you're not capable of doing that, then you're not doing your job as a public entity that protects and serves people. And so when I see what you're doing here, it hardens me that, because quite frankly, when we are trying to help different disparate communities, we don't know how. We just don't know how sometimes. And it's very heartening to see that there are people that are working on these issues. We just finished, after our response to some of the riots that were happening on some of the social discord, was we created a social justice, race, and equity commission. And one of the big things that came out of that was how you not only broadcast to all the different communities, but how do you connect with those communities, and how important that is in the work that we do. So no city, no department within a city, none of us are an island. We all have to interact and coordinate and find better ways of doing things, or just go back to being those rednecks in Alabama that just don't accept anything. And that's what we have to do to progress. So I applaud the work that you're doing. I appreciate what you do. And thank you for having me here today.
Our next welcome speaker is Marvin Lim. He is a state representative for House District 98, also the CEO, founder of Lucky Shoals Community Association, and a securities attorney with Holcomb and Ward LLP. He immigrated to Georgia from the Philippines at age 7, eventually earning his Bachelor of Arts from Emory University and his Juris Doctor degree at the Yale Law School. So join me in welcoming him.
Thank you so much, Ellen, and thank you all so much for having me. An intro was made, so I will skip the part of my notes that says introduce myself. I first want to express my gratitude to you all, not only for putting this conference together and for welcoming me here, but also for what you do. I know it takes a great deal of resilience to do what you do. I know that you all see a lot of the depths and often the extremes of the human condition, including human suffering, and will frequently, perhaps every day, have to fight off things like compassion fatigue. So I wanted to take a second to recognize that. It is very difficult to do what you do. So yes, it was mentioned, and like Mayor Park, my full-time job is actually being an attorney. That's what actually pays. But I am a state representative. I represent House District 98, which is just south of here, actually. We are currently in zip code 30093. We're in the zip code, part of that zip code that I don't represent, but most of 30093 I represent. We know that Gwinnett County is the most diverse county in the state, and it's the second most populous. And I happen to represent the most diverse part of Gwinnett County. It's about 87% BIPOC, 55% Latino, 12% Asian, even 2.5% Native American, 22% African American. In each of those, categories, we exceed or are right at the national average. So there's a lot of diversity within diversity, which is great. Diversity does not always equal community. And that's particularly true because in my area, we're also the most under-resourced part of Gwinnett. 25% of people are at or below federal poverty levels. About 43% of people don't have health insurance. And we have a not insignificant undocumented population. It's hard to get the numbers on that, but those are folks that don't qualify for health insurance or things like Ph.D. or Medicaid. So, and 25% of the people here also are designated by poor health. I'm a data nerd, if you can't tell, but it is no surprise then when I say that behavioral health and mental health are big issues here, and that's certainly true within the Asian Pacific American community here and the immigrant community in general. I think you all know, again, you all know more than I do. As I like to say, I'm choiring to the preacher that there are so many factors that account for that. Of course, there is access and affordability, and before getting more into that, I want to recognize the folks that I've worked with. I know Viewpoint is here. Actually, we just put in I worked with, my nonprofit just worked with them to put in a grant to do more resources for APIs and Latinos with alcohol abuse and going through DUIs, worked with Gina on that. I see a guide, sure, I love Michael Davis over at Guide. And I was talking to Professor Operario. I have combed the depths of Emory, Rollins, Neil Hodgson School of Nursing, iPrice, the Center for Maternal Substance Abuse, all of those things to bring them to my district because my district wants and needs that kind of assistance. So when I say we lack for access and affordability, that is not for lack of trying for the institutions that are here, which I also hope, particularly, the Viewpoints of the world, we work to put more items for them in the state budget. But even beyond that, even if you have that, of course, and it's already been mentioned, there's also, language access and cultural competency. And even when those barriers are down, there is just lack of familiarity with healthcare systems, certainly behavioral health systems, as well as just stigma. And that plays a role in all communities, but plays a particular unique role, we know, in Asian Pacific American communities. And that's something that I try to make very clear to people because, when we're talking about healthcare, we are rightfully focused on, social determinants of health, things like cost, insurance, which I've mentioned, transportation. We should obviously focus on those things. But I will also say we've had more than one behavioral event in my district, often with folks that I've mentioned, where we had free resources, where we provided transportation, where we had in-language services, where we even provided financial and other incentives like gift cards, all of the things, and still very few people came. I will say my behavioral health events are often the least attended, and even when we try to ensure privacy, confidentiality, I do want to mention that. So even when you're lowering those most obvious kind of low-hanging fruit, we know that the stigma in these communities is still very much there. And I'll say that's also played out in my own life. I like to be open about the fact that, my own introduction to mental health and behavioral health happened in 2003. Without getting too much into the details, my brother, and I'm allowed to talk about this, my brother has had issues growing up, as was mentioned. We immigrated here when I was 7, he was 8. But around a little past adolescence, he started hearing and seeing things that my family and I could not see. And again, I won't go into the details, but he was eventually diagnosed with schizophrenia. That, and again, as you can imagine, and no, not just imagine, was really scary for us. And from a larger viewpoint too, we came from the Philippines, came from an immigrant family, worked really hard. We loved each other. There was not a lack of love in the family. It wasn't a perfect family, but there was not a lack of love. But we were also pretty isolated, like a lot of folks here are. And for the most part, physically only had each other. We were the only ones of our family in the United States. So, and we were, even here, we were low income. We qualified for lots of public assistance, et cetera. So when things started breaking down, we only had each other for reassurance, which was good in some ways, but also caused a lot of stress. And looking back, I remember my parents and I would have these intense discussions on what to do, and we certainly did not always agree. think a lot of that was attributed to the fact that they were not only parents, but immigrants. I was a 1.5 generation immigrant and was a brother, which is a different relationship. That played out when I look back now and know what I know, essentially the debates about, what constitutes support and what constitutes enabling. What sorts of autonomy to give a loved one, what choices need to be taken away. I learned what the word anosognosia was very early in my life. You don't know that means you don't think you're sick. And I also look back that those very much also relate to the larger policy conversations that have been had for many years around involuntary commitment, imminent harm, deinstitutionalization, and in the present, how we want to build a behavioral health system, even when we do have resources that truly respond to people and respond to the rights of all people. So anyway, that was a time for me that, as much as anyone can start to understand, that I started to understand mental health and not only connect to it on an individual level, but also the systems around it, the good and the bad parts. And I know that while the exact permutation of events and circumstances were unique to my family, we know that the general narrative isn't. We are on the eve of March 16th, the 3-year anniversary of March 16th, 2021. And I think of the presence of mental health there very briefly, certainly for the perpetrator, but more importantly for the victims and the survivors, both before that and after that, and of the larger AAPI community. I don't want to play a tiny violin, but at that time there were 5 of us, AAPIs or Asian Pacific Americans, in the General Assembly. And I was new, and we got so much media requests. And, again, don't play a tiny violin for me, but that was very stressful to put all of that burden and feel like you have to say the right thing. And that was so much more magnified for people who were that much closer to the issue. And that is certainly you all. So again, that brought up a lot of the same themes I've already touched on, from language access to trust and stigma, which is, again, why I'm so appreciative of you all today. I think all of us agree. I have not met a single person that disagrees with the fact that mental health is important, but it is not easy both at a consumer/patient provider level and a systems level. And I will say briefly too, at the state capitol, we have put a ton of resources into this, and it still feels overwhelming. A lot of my personal work this year has been around the need for supportive housing, again, touching on social determinants of health. In Gwinnett County, there are only 150 units for supportive housing. I think a third of those are viewpoints, actually. And of course, we certainly just lack behavioral health providers, let alone that, again, speak the languages, understand cultural differences, and those who are specialized in certain areas. Two lacking being in Gwinnett County, we know that there is a particular need to talk about early intervention and early childhood behavioral health intervention, as well as those that can implement more complex therapies like DBT, which I know benefited my brother so much, but we know that insurance often doesn't pay for that. We have a lack of providers. That's true in general, and again, certainly is even truer vis-a-vis or as it impacts Asian Pacific American communities. So I will close with that and a final thank you, because I know that you are all the ones at the front lines fighting at that patient level, fighting the systems level. We are the ones that are I try to listen to you all, but encourage you all to continue reaching out to me and the members of the state government, the state capitol. The Asian Pacific American community very much needs that. So thank you again so much for what you do, and thank you for having me.
Thank you, Marvin. Please join me welcome our next speaker of the welcoming speech, Dr. Operario. Don Operario is professor and chair of the Department of Behavioral, Social, and Health Education Science at Emory University, Rollins School of Public Health. He received his Ph.D. in social psychology at the University of Massachusetts at Amherst and postdoctoral fellowship in health psychology at University of California, San Francisco. Thank you.
Good morning, everyone. I was told to remind you all, for those of you who are interested in continuing education credits to please sign up at the desk outside by the elevators and put your address so that we can send certificates to you. As Cruz mentioned, I'm Don Operario. I've been chair at the Rollins School of Public Health at Emory in the BC's department for about a year and a half now, and feel very fortunate to be part now of the Atlanta ecosystem and the broader Southeast community. As Marvin said, it's touching and challenging to be here today as we commemorate the 3-year anniversary of the shooting and the loss of lives of Asian and Asian American women, which occurred here in the city of Atlanta during the heart of the COVID epidemic. Those losses and the other instances of anti-Asian hate that became very prominent during COVID are not new. They represent a continuation of the history of anti-Asian bias and discrimination that has persisted in this country since its founding, and part of the rich history and tapestry of exclusion, racism, and marginalization among communities of color and other marginalized communities in this country. I'm comforted that this meeting represents a surge in recognition and response to the mental health problems of communities of color, and in the instance of today, for Asian Americans in particular. Data from around the country are indicating spikes of mental health problems nationally, but also concentrated among our Asian American communities, especially among youth, young people, and children. In my prior institution, for example, there were a successive string of deaths due to suicide among students. And they all had their own story, but what was interesting is one common thread among these deaths due to suicide were that they were among Asian and Asian American students. So mental health is a priority in that example alone, but in other examples that I think many of us can relate to in our personal and professional lives warrants attention and conversations such as this. These conversations are important because mental health is often wrapped in issues of silence, stigma, and shame, which especially affect communities of color and Asian Americans especially. And for Asian American communities, with regard to data, they are often not collected or not reported. So as a researcher here, I hope that this small meeting can bring about additional conversations and more partnerships to enable us to do more research, provide more data, better data on the health and wellness of Asian and Asian Americans, engender partnerships across institutions, move towards mobilization, advocacy, and policy in order to affect change. I think a lot of our conversations today are going to be focusing on the downside of psychological health, depression, anxiety, adversity, but let's also remember the positive sides of health throughout the day too. Psychological resilience, strength, assets, community, family, celebration, joy, and love, because these are also parts of the social and psychological tapestry that bring our communities together. I look forward to learning from and with you all today, and I especially want to thank Dr. Nemoto, who is the PI and the director of the Lotus project, and Jin Lee, who is the founder and the director of Catalyst, for creating this space for us all. Thank you.
Thank you so much. It's an honor to be here and to host this. I have the privilege of sharing important topic. One is Wi-Fi. Pretria guests, you don't need a password, so if you need Wi-Fi, Pretria guests. And the other one is bathroom. And so as you go on the hallway, right before the elevator, there's a women's and men's bathroom. Right? Most importantly, I also want to share just the space and what we do at Catalyst. It is to convene, to connect, and create causes for Asian American. And so if we can provide the space for meetings like this, because I know out of this time, there's going to be networking, collaboration, learning, and trust building, which I know afterwards will thrust potential movements. And if I can play a role of just providing this space, that's my job well done, I feel. And so if there's any events that you're wanting to host or need a place, please contact me and I'd be glad to collaborate and do that. But thank you so much for Lotus Project. They've been working really hard. Also, I want to thank my friend Pastor John over there. The reason why all this nice setup is the music is not we're going to have a concert, but on the weekend here, on Sunday when the space is not used, we have a church for Asian American here, all right? And so just want to let you know about that.